Diagnosing tethered cord syndrome isn't always straightforward. It usually requires clinical examination, imaging studies, and sometimes special tests. Let's break it down in this part. According to the symptoms, if tethered cord is suspected, then a thorough neurological examination is to be done, which includes to check for muscle weakness, check for any kind of sensory loss, check for any kind of coordination problem, check all the reflexes, and finally bowel and bladder involvement to be checked. The most important diagnostic imaging study of tethered cord syndrome is MRI scan. MRI scan shows the spinal cord inside the spinal canal, and it shows if the spinal cord is abnormally tethered or attached to some part of spinal canal. It also shows any kind of fatty filum terminale or lipoma, which can lead to tethered cord syndromes. In severe cases where bowel bladder is involved, we usually perform urodynamic studies. These urodynamic studies involve testing of bladder function, its capacity, and the nerves, how well the nerves are communicating from bladder to the spinal cord. Diagnosing tethered cord syndrome usually requires piecing together the symptoms, the MRI findings, and the specialized test. If diagnosed early, it gives good result. If you are experiencing this kind of symptoms, please reach out for a consultation. Follow me for neurospine health.